Hi everyone, this is Amrita from and for the Health Collective. I hope 2022 is treating you well so far, or as well as can be expected. I thought we'd try something a little bit new and see if this catches on. Would love to share with you at a regular cadence, possibly monthly, possibly every couple of weeks, what's really buzzing on the site, the kind of new pieces we have up, what we think really should be a must read or must check out. So for January, I'm going to just kick off by saying that we have a series called Pandemic Parenting, and we've had some really fascinating insights from child psychologists, from parents. I would love for you to just take a look at the interview we have with Nupur Paiva Dhingra, who's a psychologist and the author of Love and Rage, The Inner Worlds of Children, a book that's been published by Yoda Press, which they've updated with a second edition during this pandemic. And what was fascinating about this and what was really insightful, I thought, was how she talks about how distress is not the same for everyone, how kids are experiencing distress during the pandemic. For example, it's very, very different for different kids, for different age brackets, and sort of learning how to navigate through that and not to be alarmist, but really the recurring refrain does seem to be that the kids just aren't all right. And I think so many of us are struggling as adults with the pandemic. That's no surprise, but really helpful, really insightful. And one of the pieces I love is this myth that she tries to bust, saying that being unemotional is being strong. That's not the case. She also says there's a deep-seated belief that if you pay attention to your children's feelings, that will encourage them to have more feelings. This one really makes me laugh, she says, because there's a fundamental ignorance about feelings. So please feel free to check that out, have the conversations. We're here to help make those conversations a little bit easier. We'll have a new post up by Sukanya on pandemic parenting as well, which I'm really looking forward to sharing with you. And we have a lot of stories on the site. We have definitely tried to cull out the best of the best. And one more that I'll call out is, thanks to a collaboration with the Mariwala Health Initiative. This is from their fantastic reframe the issue they have by Gauri Bhuyan, talking about disability. And we've titled it Disability is a Social, Not a Physical Issue. Really important read. Do take a look. Let us know what you think. And hopefully you'll be hearing more from us very soon.
Hi there, my name is Tanmoy. I'm the founding editor of Sanity by Tanmoy, an independent mental health journalism platform. I have been a huge fan of the Health Collective ever since its inception. The Health Collective has created space for mental health stories in India, has been doing it consistently, started doing it a long, long time ago, before mental health was cool for the rest of the media. I wanted to talk to you today about two stories on the Health Collective's website that I've really enjoyed in the recent past. Both of them have to do with parenting and children and the inner lives of children and parents. The first one is by Sukanya Sharma, who writes about parenting during the pandemic. It was very reassuring to read about the emotional struggles and upheavals faced by parents during these past couple of years, how they negotiated a very complex and very sensitive and very delicate phase, which is early childhood. I realized that the emotional strain that I sometimes experienced as the parent of a young child is something that resonates with so many people. It was really validating. The second piece that I want to talk to you about is an interview with psychologist and author Nupur Paiva Dhingra on her book on the inner lives of children. And it was a fascinating interview where Nupur Paiva Dhingra busts myths about how children feel, what they feel, some of the common mistakes and myths that exist about parenting. There is a lot of pressure these days to be a conscious parent. The interview made me aware of the fact that it is okay to have your limitations. You don't have to do it all. You don't have to be a super parent all the time. And it actually made me want to pick up the book. So there you have it. Those are the two pieces that I really enjoyed on the Health Collective's website. Please go and check it out, and follow the Health Collective on Twitter, follow the Health Collective on Instagram, and join the community. Thank you.
Mental health is something which is very crucial. It impacts you at varying levels. It takes away from your productivity, your functionality. It's so important for us to focus on mental health and well-being. Particularly in the last 2 years, we've each recognized that there is a need to focus on developing and understanding and focusing on building awareness of what mental health and mental health related concerns can look like. It's so crucial that we start talking about what are the places where people can access resources and how is it that they can identify a problem and reach the right experts to be able to take care of themselves. Having access to a space where you can find that information is so important, and the Health Collective provides one such repository. It is important to access the right kind of information which is written in order to be able to give you the direction to be able to figure out what is going on with you, when do you need the experts, and where is it that you can find those experts, and how do you reach out if there is a mental health related crisis or an emergency. So it's very important that you need to get an understanding of these aspects and utilize the right kind of resources to be able to take care of your or anyone else around you, their well-being.
Hey, I'm Jessica Kalko, and I'm a part of the community at the Health Collective. The past month saw some insightful pieces go up on our website, sparking meaningful and healing discourse. Here are some I think you should check out. Dr. Karan Thakur's piece on the unseen facets of stress during the pandemic highlights how people have gone from experiencing the great resignation to the great recalibration as we apply our learnings from these difficult times to bring some ease into our lives. Neha Bedi's piece on our changing food and fitness patterns is an illuminatory look into how we adapt to thrive during a trying period, transforming the way we move and fuel ourselves for optimal living. Finally, Gauri Bhuyan's compelling piece on disability being a social issue too is a powerful inspection of how persons with disability must be represented in the healthcare sector as researchers, participants and beyond to eliminate stigma and encourage inclusive discourse. Write to us and let us know what you think about mental health in India, as well as what you would like to see next or more of at the Health Collective. May February 2022 be kind to you. Here's me, Jessica, signing off.
Hi, my name is Sunalini, and I've had the privilege of knowing of the Health Collective ever since Amrita started it. So much of what's on the Health Collective really resonates with me, in part because I have been a journalist who used to write on mental health, and in part because I've had my own struggles with anxiety and depression. So the articles that talk about those issues are always an interesting perspective for me to read on, as well as those on parenting, because you never really stop being a parent. But of late, I have tried to read a few more stories which are not a part of my life experience, and that has really expanded my own view of the world. So I'm just going to draw your attention to one story. It's called "Disability is a Physical, Not a Social Issue." And the writer, Gauri Bhuyan, is a psychologist and has a physical impairment herself. And, she talks about how physical impairment and disability are actually two very different words. A physical impairment could refer to maybe a body part that has a limitation, whereas a disability is something that the world has actually forced upon people who may have a physical impairment. So I'd urge you to read this story and several others on the Health Collective.
Hi, this is Karan. The Health Collective is more than just a collection of articles. It is actually an online community and resource for you to go and have a look at things that make a difference to you safely and securely. I'm going to highlight 5 articles that I've read most recently and have made a big difference to me. The first are the affirmations. These small doses of positivity come about every month and have made a big difference. The second is an article by Sukanya Sharma, Parenting Through the Pandemic, which I found really useful, especially with kids being cooped up at home for the 3rd year in a row. Neha Bedi's article on what food and fitness can mean now was very useful, especially with gyms and other health fitness places closed down. How can we work out? How can we stay fit? I found that very useful. Amrita's book review of Anitya by Gayatri Jayaraman on mindfulness, on impermanence, was very useful. If you haven't started your journey of mindfulness, one which I would encourage you to get on, this might be a useful starting point. The other article by Sartaj Singh in August, Living with Anxiety and Learning How to Cope, was really useful. I know a lot of us go through anxiety and we don't know what is the line between so-called normal anxiety and things that are impacting us and the way we live. The last one is a bit of a plug. I wrote this article earlier this month. It's on stress, the unseen pandemic, and how we are now in this phase of the great recalibration. I definitely request you and ask you to have a look at that, and feedback is always welcome. Do write back to us if you would like any specific subjects or topics that you'd like covered, and we definitely get them across to you. As we come out of this pandemic, I hope you stay safe. I hope you stay calm, and we are hopeful for a better year ahead.